Good afternoon. My name is Nicole Fernandez. I am with Wayside Recovery Center. I'm the project manager for the Maternal and Infant Health Series that Wayside has been hosting over the last, will almost be a year, starting in July. I want to thank everyone for taking the time to come out via the internet, Zoom, where I'm so excited that we can do so many new things on Zoom. We will record this session. The session will be posted on the Wayside landing page for Maternal Infant Health. All the series are there. It is there for the education of folks to return. If we have permission from Sara West, we can share the slides in PDF form. And we ask you only, when we do share the slides, that it's only for those who have attended. And definitely please use them for your resources in your respective places. I am going to put a link in the chat for the next up and coming Wayside Maternal Infant Health Series, and I'll share a little more details about that next session later. And I'm also putting in the chat, we love to share who our sponsors are. And we want to make sure that you know that this program is fully funded through the SOAR 2 grant, the State Opioid Response Grant from SAMHSA, in partnership with the Minnesota Department of DHS. And nothing in these materials constitutes a direct or indirect endorsement by SAMHSA or Minnesota Department of Human Services, or content services or policies. Wayside, as an organization, has served women and children for over 60 years in the area of substance use disorder, recognizing it, substance use disorder is a chronic condition. And we know how important it is to address maternal infant outcomes. And we are just happy to be in community with each of you this afternoon and really be able to move in this topic around grief and loss and just the resources for moms and families and community, and more importantly, even kinship relationships. In my time in this last year, I've learned a lot about, what can we do to serve families? What can we learn? How important it is to be able to listen and understand. And so I am super excited to introduce to you today Miss Sara West. We became connected through community. Again, the internet is an amazing thing. And I am just so happy that she will share with us. And please know, Sara is an educator in this field, and we are trying to put it into an abbreviated session. But we'd love to hear from you at the end if we need more, or what more you would like to hear from Sara, and or how Wayside can be a part of that. So just to share a little bit about Sara, Sara has over 20 years of experience as a healthcare provider, educator, and health reporter. Sara brings both professional skill and a professional connection to the mission at the Institute of Reproductive Grief Care. She directs instruction and certification for OB, pregnancy, birthing, and family clinics, as well as community agencies and health share organizations. Sara expertly guides clinics, care professionals toward best practices in reproductive grief care and self-care. So without further ado, I'm so happy to introduce you to Ms. Sara West.
Nicole, thank you so much. And I want to thank all of you for joining me and welcoming me today. I know this is a topic that we don't get to really know enough of as care providers, and also just as loved ones of people who do deal with pregnancy losses. As Nicole said, I'm Sara West, and I serve as the Director of Clinics here at the Institute of Reproductive Grief Care. We are headquartered in San Diego, sunny San Diego, California. That's where I am presenting from today. So as I begin today, I first want to stop and I want to give my honor and my respect to the Kumeyaay and their land from where I'm presenting from today. Now, the Institute of Reproductive Grief Care here, we are an active campus where organizations, individuals, they come together. We provide education, we provide research, and we also provide healing and healing resources for the grief after reproductive loss. And we also focus on accelerating that widespread adoption of the standard of care for those who are impacted by pregnancy and reproductive loss. So again, thank you for taking the time to come here today. Now, I know this is not an easy topic. It might be kind of painful as I talk about reproductive loss. So I want to mention that kind of upfront. I have been working at the Institute here for a couple of years now, really spending much of my time before that, as Nicole said, either in the healthcare setting or in the classroom. And I previously actually served in speech pathology and audiology for many years. In fact, the majority of my healthcare career was spent working with newborns and researching more valid newborn screening tools. However, about 7.5 years ago, I headed into my OB appointment for my 6-month checkup with our baby number 6. And I had been having a pretty unremarkable pregnancy, but the appointment, it didn't really go as planned, right? And within 48 hours, I had been sent to the emergency room and labor and delivery, and I had given birth to and lost our youngest son. It was probably one of the most painful. Sometimes I say it was one of the worst experiences of my life. Also, then looking back now, it was probably also one of the worst care I had ever received in my life. That lack of support, that lack of grief education, this stigma, right, that surrounds this uncomfortable and traumatic grief, it really overwhelmed me. And it took me a long time to actually kind of seek help and talk about it. And I just keep thinking that's not right for us to do culturally in our society. So fast forward to me looking for and searching for some resources, and I found the Institute. And I found a way to continue serving in healthcare and supporting others, unlike the lack of support that I had received. So please, if there is ever a point today, as we talk about this uncomfortable and very challenging, tough topic, that you need to take a break, you need to take a moment, you need to step away from the computer, please do so. I'm fine with it and know that sometimes that's what we need. Okay, so I'm going to start sharing my presentation now. Nicole, just please let me know that you all can see this. If I can get it going.
Yes.
Okay, perfect. I just want to make sure you can see this because I would like to kind of move in and talk about what the goals for today's webinar are. We're going to be analyzing kind of the emotional meaning and the impact of reproductive loss. We're going to talk about some of those cultural barriers to grieving and to care that occur in the care environment. And we're going to talk about a variety of ways to really promote emotional healing after reproductive loss. In particular, I really want to go over some best communication and language care practices with all of you. So let's first talk about that term, right? Reproductive loss. Now, reproductive loss it's really a term that is used to describe the loss that occurs after a termination or abortion or miscarriage. It can describe a stillbirth. It can describe early infant death. We talk about infertility as part of reproductive loss. We also talk about reproductive loss in the avenue when there are children who are born prematurely or even with disabilities. the child may not have perished, right? But there are many parts of that reproductive journey that we may have lost and that we continue to lose sometimes. We also like to include the foster and the adoption community when we talk about reproductive loss. There's a lot of loss that surrounds this community. Foster homes where you may have a child for a year, 3 years, and then within 24 hours, that child's been removed from your home. And then in adoption, we know that this is generally, right, a celebrated event. People are happy, but there's a lot of loss that surrounds that. Quite often, many times, the family that is adopting the child may have dealt with a lot of reproductive loss. And then you have the birth parent, right, who is also going through some of that loss. So it's really important to that I want to state up front as I talk about all of the different types of pregnancy losses and reproductive that kind of are encompassing in reproductive loss. But I also want to make a note that it's very important that we don't equate these losses, even though they are included in the term reproductive loss. We recognize that these losses occur very differently, and we recognize that the circumstances behind each of these losses are very differently. But what we have learned and what we know is that the way people grieve and the way that people heal are very similar. So one of the first ways that we can kind of present ourselves as a safe place, or that place where someone can actually feel safe enough to share a loss, to talk about their loss, and to kind of begin to start healing, right, either personally or professionally, is within ourselves. It's within our own language, right? We simply want to recognize that there are hurting people. We want to meet them where they're at without words that might have to force them to pick a side or pick a fight. We want to be present for each person right where he or she is. And our language really should not be a barrier to that invitation to heal. So it's very important that we are aware of our language and that we also mirror the language that we hear from those who are hurting. Now, to get into a little bit of stats to start this off, right? As you can see here on this slide, many, many, many people are impacted by reproductive loss. And remember, these are not simply just numbers as we're looking at these stats, right? These are real losses for real people. Surveys tend to indicate that many people think that miscarriage happens 5-10% of the time, right? And they think it's pretty rare and insignificant. But in fact, we can see on this slide that miscarriage, it happens 1 in 4. It's 25% of the time. And it's really devastating for many, many people. About 1 in 160 pregnancies end in stillbirth, which is the loss of a baby 20 weeks or later. That's about 24,000 losses in the United States each year. As many as 1 in 8 couples are experiencing problems with infertility. A lot of the OBs and researchers that we work with have said that they are seeing a rise in those numbers. We see that there are over 20,000 domestic infant adoptions that happen each year. And remember, I talked earlier about the foster and the adoptive community. Really, there's a lot of reproductive loss that kind of surrounds those challenges. When we look at this, we can see that about 2 million losses per year in the United States occur by a reproductive loss. It surrounds us, but we don't talk about it. And if we do talk about it, we tend to ignore partners and men and grandparents and siblings and family and loved ones, but it impacts everybody, right? In fact, a man wrote this. We have a couple healing websites at the Institute, and a man actually wrote this in to one of our websites in a story, right? He said this. He said, We lost our child 40 years ago. I still miss him, and I don't know if anyone remembers. So it's pretty likely that everyone here, right, in this room, this webinar today has been affected by reproductive loss in some way, whether it's personally or professionally, right? It's also very likely that we have all responded in different ways because everyone grieves differently. We grieve based on our life experiences, and we react with different intensity and reaction. Grief is definitely not linear, right? It's often quite messy. A lot of times, if you remember all those nasty Venn diagrams that we had to do in school, right? I always say that's what grief looks like in my head. It's these Venn diagrams that overlap, and sometimes it's here and sometimes it's here, right? And sometimes I'm okay, and then sometimes it's really overwhelming. You know, it just changes, and our reactions kind of ebb and flow over time with our grief. You know, if you think about it, loss can be so different, right? And more complicated if you have a loss that occurs maybe after a woman had an abortion or termination previously. And an abortion, it might feel different at 25, and then at 35, and then again at 45, right? So let's get into talk about grief a little bit, and pregnancy loss and grief. I don't know, I think most of us on this call might have heard of this term disenfranchised grief, but if not, Dr. Doka, who's a leading expert on grief counseling and therapy, has identified this term. I think he identified this term in 1989, and he talks about disenfranchised grief to describe a loss that's really not openly acknowledged, it's not publicly mourned, and it's not socially supported. The loss is really treated as a non-event, and individuals, they're not given permission to grieve. There's no path, there's no model, right? No behavior for this has ever been provided for us because we don't talk about it. I always think about this when my great grandmother passed away, right? We all knew what to do. We met together, we shared stories about her, we went through our grief and mourning together. We had ways, we had the kind of, what do you do? The process and the procedures of it. But many times with reproductive loss, there's really no modeled behavior, and we really don't know where to go or how to kind of move forward with that. We have words, right, for people when they lose a spouse, a widow or a widower. We have words for people when they lose their parents. They're called orphans, right? But we don't have a word or a term for someone who loses a child. It's almost like in society, if we don't name it, it won't exist. But the loss of a child is deemed unbearable. People don't want to hear about it, so people don't talk about it. And if people aren't talking about it, right, then there's no support or acknowledgement. And then what happens? It often results in shame and secrecy. This disenfranchisement of this grief, it can really occur right when society is inhibiting this grief by establishing these grieving norms that deny grief to persons who are deemed to have had these insignificant losses. And it might be pretty easy to believe that people don't really share their abortion stories because of social stigma or political fears. But what might be surprising to you is that people are not sharing their miscarriage stories or infertility stories either. There was a report that NPR reported on a few years ago, a study that NPR reported on a few years ago. And if any of you would like this article, please reach out to me. I'm happy to send you this article. It's titled "People Have Misconceptions About Miscarriage." And in the study, the researchers actually surveyed people on these misconceptions, right, of miscarriage. And one woman said, "I feel literally broken. It's irrational, but there is such a deep shame attached to not being able to carry a baby to term. Now, because early pregnancy loss is so common, right? Couples are also often advised not to share that pregnancy news until they hit that second trimester. But really, if you think about it, the number of early miscarriages is much higher, right, than later miscarriages. And at that point, right, the second trimester, we know that the chance for miscarriage has greatly declined. But that secrecy that we tell these parents, right, these families at the beginning, that secrecy, it means that couples or mothers who miscarry in that first trimester, they haven't told anybody their news. So now how are they going to reach out and tell people that they've had a pregnancy loss or get the support that they need? And several people in this particular survey actually responded by saying, this code of silence was even stronger for my partner, right? He didn't get time off of work, flowers, or well wishes from colleagues or visits from friends. She had to suffer alone. This secrecy and or shame, it really can lead to that disenfranchised grief, right? It's a grief that is not culturally acknowledged. It's treated like a non-event, and one does not feel entitled to grieve. Since these rules are kind of outside, right, of the norms of grief in society, quite often, even as care providers, we may not know exactly what to do. Even if we know to say, I'm sorry, we may not know what to say or do next. Or often it's so uncomfortable, we just simply don't say anything at all, right? But simple phrases like, I don't know what to say, mean more than anything. They really, really can tell someone that you have acknowledged them, right? Simply saying, I am so sorry, that must be so hard, right? It's allowing that acknowledgement of that loss so that that person understands that someone has provided them with some type of support. You may feel awkward when you are talking to people about reproductive loss, right? But studies, they've also shown by these survey responses that people don't remember how awkward you are. They just remember your support. Now, that disenfranchised grief, or the inability to express our grief and move through our grief, right? It can sometimes have an impact on one's mental health. Now, I want to pause here and I want to say that we should be very careful as care providers not to assume that everyone has a difficult or negative reaction to a reproductive loss, right? We accept all of our patients and clients and people right where they are, and we recognize that not all people are impacted the same. Now, even if someone does say that they are fine with their reproductive loss and they are not experiencing a grief reaction, that does not mean that that event was a non-event in their lives. And we can still acknowledge that event simply, like I said, by saying, I'm so sorry that you had to go through that experience. Now, sometimes, right, a loss can have an impact on our mental and our physical health, and sometimes not. Everyone really is impacted differently, and everyone's experience is unique, and our reactions may change or intensify over time if we're not allowed to be able to name those feelings and emotions, right? Many times that can kind of repress, and we're holding on to the pain, which can cause us to find coping mechanisms, which lead into habits, right? And so we need to be aware of that. We need to pay attention to behaviors when we are discussing reproductive loss that someone may have experienced or been impacted by. And if we do notice that some of these behavioral impacts are present, right, we need to make sure that we are referring or providing the support for these particular impacts first before we start that healing journey for the reproductive loss. Now, reproductive story, this may be something new that many of you have never heard of before. And I remember the first time that I was learning about the reproductive story, it floored me, right? Quite often we may hear someone say, how can I grieve someone I've never met or I've barely known? Well, Doctors Jaffe and Diamond, they're psychologists for the Center of Reproductive Psychology in San Diego, and they're recognized as specialists in the field of reproductive counseling. And they first began to kind of describe and define this reproductive story. We all have a reproductive story. We all begin to kind of write it early in our lives, right? And it changes and grows throughout our lives as our lived experience changes and grows. We kind of form this picture, this image of what our life will be like, right? And then all of a sudden it may change. So when I think of the reproductive story, right, I think of, just the differences, right? When we say it starts early in childhood, I think of, when kids are little and they kind of just watch how their world works around them. And they begin to model, right, some of those same life behaviors. And I remember when my boys were little, they're 20, 21, 19 right now, but when they were little, I remember them taking painter's tape. And they would build these like towns and roads all across the living room. And then they would take their Hot Wheels cars and they would actually kind of sort of play house, I guess, with the cars. And I think that was kind of their earliest kind of reproductive story, right? And then as I see my youngest girls now, I think, okay, now they have a story that's totally different. I have an 11-year-old who says, when I grow up, I don't want to have kids. I'm good. I'm cool with being a mom. I don't want to have kids. I want to have a ranch where I have wolves and horses. But my 8-year-old says, when I grow up, I want to be a doctor and a teacher, and I want to have 20 babies. So you can see how our reproductive story changes a little bit. And then as we become older, it gets a little bit more complex, right? And we start to think about, who do we want to have as a partner? What do we want our family to really look like? And I remember, I want this many boys and this many girls, and this is how I want that to go, right? But it changes with reproductive loss, and it's a change that's very unexpected, and it can be very devastating, right? You haven't only lost your child, but really you've lost your hopes and dreams, not only for your child, but for your family, right? So you can see how bonding kind of really does begin before conception. And you can also see how the intensity of one's grief reaction after a loss is not necessarily linked or tied to the length of the pregnancy. One element that we just simply never think of in our reproductive story is the fact that I may lose a child, or I may have to have a termination, or I may have an abortion. We don't necessarily frame a reproductive loss into our reproductive story. And when a loss occurs, we have to rewrite that story. This can be very challenging because of the ambiguous nature of the loss, right? So often with disenfranchised grief, many struggle to kind of rewrite that story because there is still this connection to the pain, rather than establishing enduring connections through a memorialization or in some kind of way. With reproductive loss, there's often an absence of those physical memories, of shared memories with the parent, and there's also an absence of that opportunity to kind of memorialize, in particular, right, with early miscarriage or termination. So you can simply see here that we may need to, as we are a care provider, help someone kind of look at their reproductive story and think about, how can I start to rewrite that story on my journey forward, right? Now, I want to talk a little bit briefly about culture and the grief experience. Through every culture, right, has its own set of rituals and customs kind of surrounding the grief experience. And there are some shared cross-cultural perspectives that have been researched and studied. And I think everyone can agree that grief itself, right, is a universal response to loss. I read this quote on a study that was completed on grief and bereavement responses across cultures. The quote says, an analysis of individuals from specific cultures reveals that individuals' intrapersonal experiences of grief are similar across cultural boundaries. Now, for instance, there are some shared common themes that we see here across cultures. There's that belief of a bond with the deceased being maintained kind of over time. There's this belief that we must feel angry at the thing responsible for the death, right? And I remember being so angry at my doctor, I didn't ever want to look at him again, right? We also have this, there's also this kind of society across all cultures. We have this feeling that there needs to be a prescribed time when mourning should end or when grief should end, right? But every society, every culture, though we have our own institutions and values related to grief and mourning, some sit with death uncomfortably, in particular, how Western society tends to handle the challenging, stigmatized, and defranchised loss of reproductive loss, while others may carry a tradition of celebrating death. And I think that as care providers, if we can really reflect on that cultural component to grief and bereavement responses and allow our patients to grieve and bereave in a way that is culturally meant for them, I think we can provide so much of a safe, supportive space. Now, quickly, I think most of us know this, but ethnocentrism is an issue that does lead to cultural disparities in care. And this also is definitely present in the Western society and reproductive grief care, right? There's a belief that certain Western grieving and mourning practices are universal. That's not so much the case, as we just kind of talked about on that previous slide. And when we have this belief, right, that the way that Western practices grieve and mourn, right, are universal, if we have that belief, well, we're posing those detriments to not only our patients and their families, but also to ourselves and to our colleagues as care providers. Our personal perspectives are many times mixed, right, with our society's own cultural experiences and perspectives and stigmas and stereotypes. And when we are using our language to be that safe place for support and for healing, we need to, as care providers, be very attentive to our own perspectives, but also to realize that our perspectives are ours, and we need to make sure that we're meeting our patients and clients right where they are. So as we kind of talk about how grief really after loss is universal, right? And this topic of reproductive loss, it is universal. It's a universal topic, right? I love this quote here. It says, there are no sensitive, move my little thing around, there are no sensitive issues in reproductive health, but there are insensitive approaches to reproductive health issues. And I love that, because it is all about the approach. It is all about our compassionate care practices, our language that we are using, and that we are really informing ourselves of the language that could be traumatic, right? So that we are not further traumatizing someone when we are supporting them after pregnancy loss. So I want to talk briefly here now as we move on about what grief looks like and how we might work through it. I know many of you might have studied and heard about Dr. Elizabeth Kubler-Ross and her stages of grief, right? That ended up becoming very linear and ordered but I don't think she intended it that way. Actually, she said she didn't intend it that way. But what we have learned, right, is that grief really isn't ordered and linear. You don't close one door and move on, right? It's not taking a test, passing it, and then moving on to the next stage. It's continuous. We're always moving in and out of these tasks of grieving throughout life. Dr. William Worden, who's a world-renowned psychologist who specializes in grief counseling and therapy, he actually found that rather than those stages of grief, we do move through these tasks of grieving. And he said there's really no order at all. You often move in and out of some of these as you grieve for life, and it's not linear. So there can be good days, there can be bad days. You can't really fix or close the door on grief, but you can find a way forward, right, to a new self. I may always carry a piece of my loss with me. I will always carry a piece of my loss with me, right? There's going to be trigger dates like holidays and anniversaries. Quite often, many times, my grief really does feel like a roller coaster, right? Sometimes I'm great and having fun and laughing, and then I get sent on a loop, and then it's woo for a little bit, right? And then I'm okay and riding around and dealing with my ups and downs and loops. And then right when I get to the end of that ride, right, and I think it's over, it sends me on another loop again, right? So you don't always know what's coming with grief. You don't always know what direction you're heading, backwards or forwards or up or down, right? But we can kind of use these tasks of grieving to understand how we can intentionally and meaningfully kind of move through with activities that help us on our healing journey. I actually had a woman say to me 6 months after her miscarriage, to be honest, I thought the worst was over, but I guess life and emotions really aren't on any sort of schedule. So let's look at these tasks of grieving that Dr. Worden talks about, and let's see how he breaks them down, right? I'm not going to say first, second, third, fourth, right? Because we don't go through these as stages. I'm simply just going to talk about these tasks of grieving and say we move in and out of these, right? One of these tasks of grieving here is to accept the reality of the loss, right? We're not accepting the loss, but we have to accept the reality of that loss. Oftentimes when someone dies, right, there's this sense at first that it really hasn't happened. And ultimately, we have to come face to face with the reality that that person, that baby is no longer here with us, right? And will not return. And it really takes some time to work through that intuitive, that intellectual, and that emotional acceptance. We also really, when we're talking about accepting that reality of the loss too, we have to think about not just the fact that the baby has died, but there are other losses, the loss of those hopes and dreams, right? May have a loss of a relationship with my partner or my family. I may have a loss of a relationship with my job. I may have a loss of a relationship spiritually, right? So there's all sorts of loss that surrounds the loss of a child there. We also have a task of grieving that we go through where we really are processing the pain of the grief. Dr. Worden actually really acknowledges that each person and each loss will mean working through a different wide range of emotions, right? You might go through a lot of them at once, or none of them at once, or one of them at once, or many of them at once, but we may go through sadness, fear, despair, guilt, shame. We may even feel relief. There's so many different emotions that we must go through, but a person must acknowledge and talk about these feelings in order to begin to really understand and to work through them. The danger, as I mentioned earlier, when we talked about the potential impact on mental health, the danger of not really being able to process these feelings and to name our feelings and emotions is is really going to lead to unhealthy behaviors if we continue to deny them and repress them, right? I really struggled with that myself, which was my personal experience. And it's going to be different from others, but I really struggled with being able to name my feelings because I really shut myself off from them, right? And that led to some really unhealthy behaviors. And we want to just be very wary of that, because there is that potential impact on mental health. Another task of grieving that Dr. Worden describes is that when we are moving through our healing journey, and when we are helping others move through their healing journey after a reproductive loss, is there's this adjustment, right? That sometimes we have to do again and again, but there's this kind of adjustment to the world without the deceased. You have to, like I said earlier, rewrite that story. You've got to kind of create a new future for yourself, for your family. What does the world look like without that person? We can't go back to the way it was before. And oftentimes we hear people say that. I've said it so many times. I just want it to be 8 years ago, right? I just want it to be 8 years ago. And then I'd see that positive pregnancy test, and then I'd be happy and I'd be fine and I could maybe do something about it, right? But that's not really, when I get those feelings, I think, oh, I've got to kind of readjust, right, to the world without him. We have to rewrite that story. And sometimes we have to rewrite that story again and maybe again, right? Another task that Dr. Worden talks about is finding an enduring connection. It's really hard when we are in our grief, and in particular, in our grief with reproductive loss, it's really hard to let go of the pain. There's that ambiguous nature of the loss. It's hard to let go of that pain because many times that pain is the only thing that we have left to remember and to hold and to really keep, right? If I stop feeling the pain, then I might start forgetting. And it's kind of fearful, but helping someone and helping ourselves find an enduring connection in some way to continue to memorialize and connect to the deceased will really help us as we are moving through on our healing journey, and really kind of moving through on that new story, our new reproductive story as we continue on. Someone said this once about being able to find an enduring connection. Finding ways to remember actually helps people gradually come to terms with the loss of a baby. It helps them remember, but it also helps them let go. It's really hard, right? We talked about that ambiguous nature of loss, that connection of pain and guilt people can hang on to because they don't want people to forget. They don't want to forget themselves. And this is why memorializing is really so important. If you can do anything as a care provider to help someone who's been impacted by reproductive loss, please help them find ways to memorialize their child or their children. There's many different things that we can do, right? Memory boxes, token items, planting a tree or flowers, in some way that we can find and establish an enduring connection that's not pain, right? Now, although everyone grieves differently and at their own pace, Dr. Jaffe and Dr. Diamond also found that these were three fairly consistent themes among those that were grieving a reproductive loss. That not only has the child died, right, but a part of them has died as well. And there's that loss of hopes and dreams, not only for their child, but also for themselves, for their family. And there's this feeling of failure at the most basic level. One woman on that NPR report I was talking about earlier, one woman in the study, she actually stated this. She said, "I wish people knew how much it's possible to miss a person you have never met and to mark time by their absence. I will always think about how old my baby is and what our lives would be like if I hadn't lost the pregnancy. So many people, as we grow, right, many people just assume that we can have children. And oftentimes we're quite unprepared, right, if we cannot. And it can really cause and stir up those feelings of failure for many. This quote I related to, this was a woman said this on one of our websites, and I really related to this quote so much. She said, "My body betrayed me. I'm a failure. I cannot carry a baby." And I know that some people may question this feeling of failure with abortion, right, and termination, but many sense too that they're failures because they cannot welcome a child or care for a child, right? And we had a woman state this on our website, abortionchangesyou.com. She simply said, "I feel angry that I couldn't take care of this child. I couldn't protect it as a mother should. I feel like a failure because I couldn't provide a life for this child." Now, I think too, when we're thinking about reproductive loss, right, and these feelings, right, that we have surrounding it, I think too, we need to remember as care providers that quite often, in particular with reproductive loss, there might be multiple layers of grief there. You can just imagine these feelings after multiple miscarriages, or the feelings of failure, right, of having a miscarriage, maybe after having an abortion previously, right? So sharing our stories, really, it's that important first step of our healing journey. It's the way that we can share our story and move forward and rewrite it so that we can take a look at these common themes and say, okay, how can I really move through these tasks and continue forward on my journey? The stories I kind of briefly mentioned in some of the shares I've stated are really on our websites. They're really a testimony to how unique all of our grief and lived experiences are. But the stories often really reflect, and these quotes really reflect, how not alone in reproductive loss that we are. Everyone is unique, right? This sharing of grief tends to come naturally when someone who's lived in this world dies, but it's not so much the case with reproductive loss. Now, we do offer healing websites, like I mentioned, miscarriagehurts.com and abortionchangesyou.com. And these include meaningful and intentional healing activities that allow someone to really work through those tasks of grieving that I just discussed. With grief, we may need to kind of revisit these healing activities on and off throughout our lives. As we know, there may be some triggering moments, some triggering seasons that send us through another aspect or task of grieving. Many people who have suffered from reproductive loss or have been impacted by reproductive loss simply don't feel entitled to grieve, and we can help them, right? We can invite them to start that healing by simply normalizing their grief. Or if they don't have a grief reaction, we can normalize that for them too, right? We can tell them, you are not alone in this. You are not alone in this grief. You are not alone in this experience, right? We can really tell them that there's really no right way or wrong way to grieve. There's no timeline for our grief. There's no shoulds, right? And I remember the grandparent right after our son passed away. I remember the grandparent that kept saying, well, next time you should do this. And next time, I remember the biggest thing was, you shouldn't have been pumping gas. You should have had somebody else do that, right? And I thought, well, we can't say that. There's no shoulds or shouldn'ts in this, right? Everyone grieves differently, and within the same family too. And I think that if we can recognize that even within a same partnership or family, everyone's going to kind of have their unique way of grieving, but simply by listening to someone's story and telling them that this is normal You are not alone. It's okay to feel blank, right? We're validating grief. And at the same time, we're kind of educating them on the grief process. So goals for grief care, as we start to kind of get through and wrap up our webinar today, those websites are a really great place for people to kind of start, and it's a great place for you as care providers to take a look at those activities to use them. But I really just want to remind you, right, that whether we're in our personal lives or our professional lives, you and I, in every situation of reproductive loss, are the invitations. We can acknowledge one's feelings, right? Simply by saying, I am so sorry. We can listen, and we can listen without judgment, right? We need to take our perceptions and set them aside, right? We can support and we can encourage. Now, we cannot force healing, just like we don't force grief, but we can support and we can encourage. And of course, we know that we're going to refer appropriately for more help if it's needed. Our roles are going to be different in different situations for different people who share their reproductive loss. And often, many times, you may simply just be the invitation. So when we are approaching our grief care, right, we need to make sure that our language is very patient-centered. Up on this slide, you can see that I've reminded everyone, which I think we all know this, right? We need to make sure we're respecting and including the patient's cultural aspects toward grief and their loved ones' cultural aspects towards grief, right? We need to make sure that we are holding the couple and the family with dignity. Now, you can always start the conversation with someone. If you are in your practice, you can always start the conversation at intake. But this slide is simply, it provides you with some different ways of language to ask someone to be able to share a loss, right? So these questions are simply just tools, resources for you to think about your own intake forms and how you would approach people and some of those questions you ask. So we've got this form for you. Use this language, right? This is a great language tool that's not triggering for someone who's had a loss there. And responding to losses. Now, we've talked about saying, I'm so sorry, right? I'm so sorry for your experience, and I want you to know that you're not alone, right? But this slide here, remember, it just simply tells us how we can support someone, how we can support a family, how we can support a couple. It's really important, right, that we are acknowledging their loss, holding couples with dignity, holding families with dignity, right? Telling them that we are sorry for the experience. And also, I think it's really important that we are asking how they're doing and that we're asking how we can support them, right? I think that if we can talk about memorializing, if we can suggest ways to do so, if we can think about some of those healing activities, such as really naming our emotions, right? I think that if we can brief family and friends, if we can give them a little bit of that grief education, this is something that you may kind of experience again and again, and it may kind of move up and down like a roller coaster, right? And of course, we can definitely provide them with some resources. I've given you all a couple of resources on our websites, and please reach out because we do have a lot of resources here, right? But we really want to have this conversation, and we want to be able to use our language to provide the best compassionate care practices, right? Because we want to have that conversation with someone who has been impacted by reproductive loss that allows them to leave feeling hopeful. Now, you guys have all joined me today, so you're very likely in some way caring for people, right? And in turn, that means you're going to encounter a lot of loss. And you may also encounter a lot of reproductive loss in caring for others. And we want just to kind of remind you at the very end of the webinar today that you have to take care of yourself too, physically, emotionally, spiritually, to be at your best, right? So remember, please, to set aside some time every day in your personal and your professional lives to really fill that cup up and re-energize, right? And I know that defining self-care really sounds, it's a bit like trying to hit a moving target, right? And it really depends on the person and the circumstances, and it can change moment by moment. But we set some ground rules up here for you on attaining your self-care, and it's really do what your mind and body need, right? Even if it's for 5 to 10 minutes. When I worked in the clinic and hospital settings, I remember pulling a chair over to an empty patient room window and just 5 minutes of vitamin D time, whether there was sun or not, right? Just make sure that you're not doing something, that you're actually involving doing something for someone else. Self-care time is not that carpool time, right? And the car pickup line, you're actually doing something for someone else. You need to really allow yourself to get lost in that experience, right? So please be sure to fill up that cup so that you have the continued capacity to care. Today is just a starting point. We will be sharing another topic on reproductive grief care, I think September 8th. One of my colleagues here at the Institute will also continue a conversation. So I've given you some things up here. The healing websites are up here on the screen. And really, I want to also say, consider taking steps to become a certified reproductive grief care specialist. We have both organization and individual certification tracks. The courses, we've got some additional courses. We've got more advanced continuing ed courses. We also have courses for nurses that provide contact hours. And then once a quarter, we offer a research series. It's a quarterly lecture series where research that we are collaborating on or working on in-house, we share, and a live webinar panel discussion. So please join us. Please let me know if you have any questions about anything that we do at the Institute. It's such an important mission, and I just want to thank all of you for joining us today.
Thank you so much, Sara. I just appreciate the space that you provided today for everyone, and to recognize that reproductive loss and grief, there is a very wide continuum in terms of how we experience it, but there's a place where we all can be supportive. And so thank you so much. We do have maybe just a couple of minutes. I know we're right at 1 o'clock, but I do not want to send anyone away that may have a question. You can put it in the chat and Sara and I can see it. If you have any questions, she did mention there is an upcoming maternal infant health series that will be happening on September 7th. That will be with Catherine Grauerholtz. Thank you, and Dr. Lauren Roble. So that will be happening September 7th. And then we have another Zoom more closely happening on the 20th of July, Helping Children Thrive, Addressing Health Disparities and Fostering Social Emotional Development Among Youth in Foster Care. We really are trying to expand this continuum and this conversation around maternal and infant health. I'm not seeing any questions in the chat. People may need to go, but please you can send those questions. Sara has placed her email in the chat, as well as we will be sending out a survey for you to respond to that survey. Give us feedback, give us some more information or questions that you may have, and we'll be happy to respond. Again, we thank you, Sara, and we thank everyone for attending the Wayside Maternal Infant Health Series. Thank you so much. Have a great afternoon.
Thank you.